clinical, I would say it's a difficult thing because clinically we do have some classic scales like EDSS, like 25 feet walk test or 9-hole peg tests, and these all assess patients' general ability to perform in different functional systems. So these scales are generally broad and would probably not be specific for progression or for smoldering MS for that matter. So from the clinical side, but more precise, is probably radiography. And within the radiological armamentarium that we have, MRI is definitely the strongest and the most accessible these days. So I would say that measuring the number of paramagnetic rim lesions, the so-called PRLs, which could be an equivalent of smoldering plaques because there's this rim of iron around the plaque, I think that's a very promising marker. Slowly expanding lesions, that's a little bit different term. You don't define the irons, you just, the iron rims, you just define whether the lesion expands or not. So if the lesion is expanding over time and you use volumetry to measure that, then it means it could be a smoldering lesion too. So chronically active or smoldering or slowly expanding lesion. So I think these two would actually be the most useful with regards to smoldering MS only. But with regards to progression, of course, there's a lot of other MRI methods to measure that. And most importantly, it's probably spinal cord atrophy that is more difficult technically. So it's not an easy process to compare the volume of spinal cord year by year, but it is doable. And it's a very strong indicator of progression. Also, thalamic volume, for instance, it's a very, very is probably an overstatement, but a relatively easy parameter to obtain from MRI studies using the volumetric sequences. So thalamic volume as well. And of course, visualizing cortical lesions, which on standard MRI are not so well visualized. So you need special sequences like DIR sequence to see cortical lesions. And I think the future is including DIR and SWI sequence, the latter for central vein or PRLs identification in the sequence algorithm for multiple sclerosis patients. So definitely imaging. I have to mention also PET scan because PET scan allows us to visualize macrophages, for instance. So of course it's a very expensive examination, so it's now being used only for research, but I think it's worth mentioning as well. And not to forget, since you asked me about the clinical and I moved so easily to imaging part, not to forget the patient-related outcomes, because identifying progression is a very difficult task for a radiologist, and usually we define it much later after it has begun. So paying attention to what the patient says and maybe using questionnaires on a regular basis, wearables, so that's another great source of information about patients' everyday function, that's going to be useful here too.